medical students from Southampton University. The weekends, he helped to run a palliative care hospice in Hampshire, looking after terminally ill patients, and he has since worked for several years in the local emergency department. Dr. White was also clinical supervisor of newly qualified doctors. He is a UK-based primary care physician focused on functional medicine. All along, Dr. White has asked questions about the handling of the COVID-19 pandemic. In early 2021, he resigned his position from practice since it became clear that the intention would be to recruit even younger patients, including children, into the vaccination experiment. As a result of speaking out, including a video published on social media of why he resigned as a GP partner, and publicly whistleblowing about what has been happening within the NHS, the National Health Service, Dr. White has been suspended from NHS and now faces a trial by the General Medical Council for spreading false information and misconduct. This could ultimately result in a loss of his license to practice medicine. However, he remains committed to his practice in functional and holistic medicine. So a warm welcome to you, Dr. White.
Thank you. Lovely to be here.
This is really great. I mean, let me start with a very basic question, which is why and how did you become involved in SARS-CoV-2 issues?
Well, to say I was involved is a difficult one. It was more that I was concerned about a narrative which was built upon PCR in the absence of proper clinical assessment, which I think is highly inappropriate. And we discussed already here tonight the indiscriminate use of PCR testing. At the same time, people were losing their businesses, their livelihoods, and all aspects of their life were being determined by this test, upon which they might not have any symptoms. And those who were poorly and becoming sick in the community, I was unable to help them in any way with safe, proven therapeutics. And it became clear from the UK government and the government advisors that the narrative and our only way out of this as a collective group of people of 65 million people was vaccination only. And then I simply went back, earlier last year and looked at what happened with the SARS-CoV-1 trials, which obviously didn't get beyond animal studies, and for good reason. And that was enough for me in December when the UK first rolled out the Pfizer vaccine to say there's no way I can offer my patients informed consent. I can't tell them what the risks or benefits are. But based on the previous SARS-CoV-1 experiment, it was enough for me to say then I don't want any involvement. And then, as you rightly say, my thoughts were that the narrative changed to injecting more and more younger people who really weren't at risk of this disease, all the while withholding any treatments.
Dr. White, we will soon come to the question of the vaccines, but before we do that, you've been in practice, and I would really like to ask you, with COVID-19 presented as a probably deadly disease, and thus understandingly spreading fear, well, sometimes even panic, one should assume that official institutions would accept merely any treatment, even if it had some minor side effects or was comparably expensive. Based on the experience in various countries, there are cheap and safe drugs, like, for instance, ivermectin, which have, if given correctly, major impact on the outcome of the disease. As UK, in addition, due to its colonies, has had vast experience with this, by definition, antiparasitic drug, was or is it used on a broad range in UK?
It's not commonly used here at all, and it's actually what's defined as a special order. So even if I was to put it on a non-NHS prescription as a private prescription for a patient, which I can't do any of that at the moment because I'm suspended. But even if I was, it would be incredibly expensive for a patient to purchase it of their own accord. So it could easily be made a lot cheaper if the health service decided to buy in bulk. And I think Dr. Laurie explained that it's around $3 per tablet, essentially. And of course, the dollar is very weak at the moment. So we're talking about a very cheap and inexpensive drug with decades of safety data compared with an entirely novel vaccine, which I loathe to call a vaccine, for which we have no medium and long-term safety data whatsoever.
Well, that's exactly the next point. I mean, UK was one of the first countries that rolled out a big vaccination campaign. I mean, it's widely known that the vaccines are all in phase 3 of the studies still. Thus, at the moment, they must be classified as experimental, which is also mirrored by the fact that they only got emergency use authorization only. How is the general vaccination strategy nowadays in the UK?
It would appear, according to the official sort of government reports, that the majority of adults in the UK are double vaccinated. And I've even recently seen adverts appearing for a booster shot in the autumn period, combined with the flu vaccine shot, for which I'm very fearful of the outcomes of that, given the potential for ADE, essentially antibody-dependent enhancement, that we've seen already, along with the 4 broadly categorized adverse reactions that we've seen, which are sort of hematological, immunological, neurological, and cardiac. And when we think about cardiac complications from these vaccines, we need to think about young adolescents, especially boys, who are developing myocarditis, sky-high elevated cardiac enzymes, along with corresponding ECG and echo changes. And when I chatted to Prof. McCulloch recently, sorry, yeah.
No. You see, we have to stick to the time, and I have still some more questions to go. I mean, based on what you said, based on the formal requirements, these products must not be applied as long as there is no informed consent. How is this handled in the UK?
Exactly, and that's why myself and my legal team have launched a legal challenge, and there's a crowdfunding site for people to donate to as well for that. And the principle of that is that informed consent is actually enshrined in law, and there cannot be informed consent for these vaccines whatsoever, because along with informed consent, where you might talk to someone about the risks and benefits, you also need to talk about what the alternatives are. And the alternatives might simply be not having a vaccine or not having any treatment. But any treatment should also include a discussion about therapeutics. And of course, we're not allowed to even talk about them. And that's why I'm in some hot water.
But you told us that so many people are vaccinated in the UK. Are these people informed in a proper way on indications and contraindications, probably severe side effects, the real effect of this? I don't call it vaccines, it's injections.
Yeah, exactly. I would call it injections. And I've gone a bit further to say genetic manipulation in my video, which went viral. From the evidence testimony that we have of people who've gone through the process, no, it would seem that the full informed consent process has not been adhered to in a manner which would be in keeping with sort of good medical practice, essentially.
Dr. White, for the moment, thank you very much for your contributions. I hope you will join us in a few minutes in the final panel discussion. Thank you so much. And I want now to move on to Dr. Thomas Binder.